A positive change of facial appearance doesn't always require a surgical procedure. There are many non-surgical options to help you look your best. We talk with Dr. Alexander Rivkin of the Westside Medical Spa in Los Angeles about the many options.
This procedure, I've called this procedure non-surgical nose job. I've also referred to it as 10-minute nose job. So whichever title is fine. What it is a non-surgical way of correcting imperfections of the nose, such as bumps, crooked nose, as well as drooping tips, or some Asian clients will come in and they have a not very well-defined bridge of their nose, and so they want more definition. That's a way of doing that as well. It's a replacement for surgical rhinoplasty in some cases, not all cases. It's a series of very specific injections of a filler material called radiance. It's calcium hydroxylapatite. And what that is a substance that's been used in surgery for a long time as an implant, as a solid implant. It's similar in its effect to collagen, which means that when you inject it into the skin and into a certain deep layer of the skin, and it lifts it up, it plumps up the skin, and it stays plumped up. As a physician, I want to make sure that what I'm injecting, there's no allergic reaction, it's non-animal based, it doesn't get absorbed by the body, there's no, and it doesn't move. I'm the first physician in the United States that has been doing this procedure as an alternative to rhinoplasty. This kind of thing has been done before, where after rhinoplasty there's been a little bit of a defect and they've used these kinds of filler materials to fill in a little bit of defects. But nobody's ever done it as an alternative. Today we're going to see a patient who I have performed the procedure upon recently, and now she comes back for a touch-up, which is very common. And she had a bump on her nose right about here, and what she wanted is just very simply to have a straight nose and to have a profile that just went, without the bump. And so I managed to correct that nicely, and now she comes in for a touch-up after the swelling comes down, and we will give her the final result today. The procedure itself involves putting some numbing cream on her nose. We use ice also to make sure that it doesn't hurt, and then I do several very specific injections in certain points of the patient's nose in order to fill up the skin, plump up the skin in that specific area, and camouflage any kind of bumps or imperfections that she may have. The procedure is extremely successful, and the success of the procedure, really it's about 100% success rate, because the patient has a mirror in front of them. I'm talking to them as I'm doing it, and it's completely under their control. They don't go to sleep and wake up and, oh, here's your new nose, hope you like it. They are, every step of the way, they're in complete control, and their expectations are fulfilled. And that's really what I want to do. I want to fulfill their expectations, and that's the benchmark of my success. Not something that I think is perfect, but it's something that they think is perfect. And that's why it's successful.